banking. So a lot of patients ask me about the newest biologics that are coming out in hair transplant. When will we have hair cloning? When will we have biologics where you take stem cells from the back and use that to, grow some hair around? When will we be able to use the cells? Like there's different things on the market today, and a lot of people conflate these. So there's platelet-rich plasma. There's using something like a regenerer, which takes tissue, fat actually from the back, grinds it down, takes out the hair follicle part, and allows you to re-inject it. That has some promise as well. There's exosomes, there's cell multiplication services. The bottom line is that all of these things will require tissue banking before you get to use them. So if you're a younger hair loss patient, anyone below the age of 45, now is the time to tissue bank. And even if you're interested in something that is not yet invented, now is the time to tissue bank. Why? Well, it turns out that tissue banking is age dependent. So once you're experiencing a little bit of hair loss, that's the time to tissue bank. The younger you are, the better your cells multiply, the more robust they are, the better they preserve. So all of these things really follow from how good your tissue is. And younger than the age of 45, it's around 45. It's not perfectly 45, but somewhere around that age, and the younger, the better, you should bank your tissue. Tissue banking is easy. This is not like getting a hair transplant. This isn't even as bad as platelet-rich plasma injections or exosomes, which in and of themselves are not bad at all. So what this entails is about between 60 and 90 minutes, a little bit of numbing at the back of your head, and you go straight back to work. The cost isn't even that high, $150 a year for banking your tissue. There's a one-time associated cost with actually taking the tissue out, and it's only 100 individual hairs, not even grafts. Most grafts have between 1 and 3 hairs. So, you do the math, that's probably somewhere between 30 and 50 follicles, depending on what your hair type is like. And we're only taking them from the back here. So the number of little tiny dot scars that you would have, usually we diffusely kind of fan them out. So this is not something that almost anybody has an issue with. Almost everybody can do this. And let me tell you right now, the instant that this became available, I tissue banked everybody I knew who was in my family who is younger than 45. So this is a huge deal. Our whole industry is about to become centered on these biologic therapies. And if you're in the EU and you're looking this up, look up the Human Tissue Authority. If you're here in the United States, the FDA, the subset of the FDA that deals with this is called it's a biologic. So all of these things are going to require you to tissue bank, and tissue banking is easy, and it's also pretty cheap. So you should look into tissue banking. If any of these biologic solutions for your hair are of interest to you, you should definitely look into tissue banking. If you have any questions about it, you can always give our office a call. And I look forward to answering any questions that you do have, because I love to talk about this stuff. Have a great day and get out there and bank your tissue.